Stroke is the leading cause of disability in the United States.
And for many, a stroke affects the mobility of their arms and hands, and that makes everyday routine activities almost impossible. Latrice Curry has more in Eye on Health.
Well, David and Cindy, there's a new clinical trial that's giving hope to the more than 800,000 Americans who suffer from stroke each year.
You're going to pick that one up and then put it in here.
After surviving a stroke, Ken Meeks continues to recover, but some tasks still take longer than he'd like.
Nearly everything you do is a two-handed thing. You don't realize it.
Loss of motor function is a common side effect, one that can take years to recover, which is why experts are testing a new approach to stroke therapy, using an implanted device to help rewire circuits in the brain.
The idea is to combine this brain pacing with normal rehabilitation therapies and see if patients who've been through all of the other usual therapies after stroke can get even better.
Dr. Marcy Brock-Brader is leading the study with the VivaStim vagus nerve stimulator. She says the nerve stimulation is like turning on a switch, making the patient's brain more receptive to therapy.
What we're trying to do with this is rewire the brain so that it will allow people to be able to use their bodies the way they used to.
The novel therapy is used in conjunction with traditional rehab. When an exercise is performed correctly, the therapist presses a button, directing the device to stimulate the vagus nerve, which carries information for motor functions within the body. This signals the brain to store that movement to memory. Then patients are evaluated in comparison to their pre-therapy scores.
I'm able to do these faster.
Yeah.
And I'm not quite as tired when I get home.
Because this is a clinical trial, Ken's not sure if he's actually getting the stimulation or not, but as far as he's concerned, there is no such thing as too much therapy.
I truly believe, I still believe that it will be a help.
Well, the clinical trial will follow patients for at least a year to study their improvement, and researchers are hoping that what they learn will not only improve their lives of patients who've had a stroke, but also they're hoping that their findings could also help those who've suffered from spinal cord injuries and also traumatic brain injuries as well. So interesting to follow these clinical studies and see how they're helping patients.
Thank you, Latrice.